If you're a caregiver, clear communication is a key part of the relationship between you and the person you're caring for. However, if they're living with a hearing or speech impairment, communicating effectively can sometimes be a challenge. In this video, we'll give you some advice on how to maintain good communication and provide the best care possible to someone with impaired hearing or speech. When caring for someone with a hearing impairment, it's important to avoid things that may startle them. Always try to approach them from the front so that they can see you coming, and don't ever touch them without telling them in advance. It's a good idea to eliminate background noise whenever possible, so keep any devices like TVs or radios turned off when they're not in use. Even if the person you're caring for still has some hearing capability, don't try to communicate with them from outside their field of vision. If they can read lips, make an effort to speak at a normal volume and regular pace. Don't over-exaggerate your lip movements or shout at them. Just because they can't hear doesn't mean they don't understand. Maintain eye contact when you're having a conversation, and remember that even if they have an interpreter, you should still be speaking directly to them. If they're having trouble understanding you, don't be afraid to write things down for them. It can help to keep a pad of paper handy, or use the Notes app on your phone if that's more convenient. There are also a number of other smartphone apps available that may help you communicate, including voice processors, vibration-based sounding cues, and sign language dictionaries. It's worth sitting down with the person you're caring for and taking some time to explore whether any of these steps might be a good fit for them. Caring for someone with a speech impairment presents its own unique set of challenges. Not being able to communicate a thought or need can be both frustrating and exhausting, so reassure them that it's okay to take their time and go at their own pace. Give them your full attention by removing any audio or visual distractions from the room and maintaining eye contact throughout your conversation. Don't talk down to them, and don't try to finish their sentences to make the conversation move faster. Ask yes or no questions when you need clarification, and don't just assume that you know what they're trying to say. It's okay to ask them to repeat themselves if you don't understand, and if you continue to have trouble, don't be embarrassed to ask them to write things down. Like with hearing impairment, there are a variety of smartphone apps available to help people with speech problems, so take some time to investigate whether any of these apps might work for the person you're caring for. Although being a caregiver for someone with a hearing or speech impairment can present certain challenges, it's far from impossible. By working together, you can develop a system of communication that will make things easier for both them and for you. Be sure to subscribe and watch our other videos for additional caregiver support and resources.
If you're caring for someone with dementia, you may have noticed that near the end of the day, they sometimes feel confused, restless, or agitated. This behavior, known as sundowning, can be a scary experience for the person you're caring for, and might also cause you to feel overwhelmed as their caregiver. In this video, we'll look at a few of the things that cause sundowning and give you some helpful tips on how to manage it. There are a number of factors that may contribute to sundowning. Some of them could be related to the habits and physical needs of the person you are caring for, while others might have to do with their environment. Here are a few questions you can ask yourself to help identify what may be triggering their sundowning. Do they seem mentally and physically tired by late afternoon? Are they often up during the night and asleep during the day? Are they receiving too much daily stimulation or not getting enough? Do they seem to be struggling with physical issues like hunger, dehydration, constipation, or pain? Does the lighting in their living space create shadows that might cause confusion or hallucinations? Could they be picking up on the stress of others, including yourself? If you answered yes to any of these questions, you may have discovered one or more of their sundowning triggers. Now that you know what to look for, here are a few tips that can help you manage the effects of sundowning on the person you are caring for. Keep track of their activities, behaviors, and environment to look for patterns that could be making things worse. Stick to a regular routine, scheduling activities earlier in the day and encouraging them to rest in the afternoon. Check in regularly about their comfort levels regarding hunger, pain, and the need to use the bathroom. Limit their caffeine and alcohol intake, and try to plan larger meals earlier in the day. Provide more lighting to help reduce the amount of shadows in their living space after dark. Get them to join in a simple breathing exercise to help calm them down. Sit together and slowly inhale through your nose, then exhale through your mouth for 5 deep breaths. If they get restless, take them for a walk or drive with the help of someone else they can trust. When it's time for bed, try closing the curtains, turning on a nightlight, or playing soft music to make it easier for them to fall asleep. If problems persist with their sleep schedule, inform their doctor about the symptoms and ask about whether there are any medications that might help. During the course of your day, it is perfectly okay to step out of your caregiver role to enjoy a few minutes of me time. If you're stressed out or overtired, it may contribute to the person you are caring for sundowning. For more tips and strategies on sundowning, check out our care guide.
As a caregiver, the person you're caring for may need you to help them with their personal care, and sometimes you may have to do some unpleasant tasks that you thought were only done by nurses, doctors, or other healthcare professionals. This can be stressful, and it might feel life-changing, but you also know that you have to get it done. So where do you begin? In this video, we'll give you some tips on how to do those awkward tasks a little easier and help reduce some stress. Let's try it. First, try to distract yourselves from what you're doing. Like when you're giving a bed bath, you could have the radio or TV on in the background. This will give you both something else to focus on. Try talking about something totally off topic from what you're doing. Maybe chat about what you're going to have for lunch or what you think is going to happen next on a favorite TV show. Keeping the person you're caring for as covered as possible during personal care is also helpful. Using a towel or sheet to keep them covered up can make washing a little more comfortable and has a side benefit of keeping them warm while you work. Get through it as quickly and safely as possible. If you're in between showers and bed baths and you have to do something like wash their genitals, try using special wipes to do this instead of a full wash. This will make the process a lot quicker. Also, if they're able to manage some of their own care, have them do as much as they can themselves. You may be able to have them wash their genitals in the shower and just be nearby for safety and to help them wash their back or feet. When you're doing these tasks, you're both probably feeling uncomfortable. It can be helpful to just talk about your feelings openly and say it's uncomfortable for the both of you. Try using the medical terms for the hard-to-get-through tasks. Instead of saying you're going to wash their genitals, opt for the medical terms and say that you're going to do their perineal care. It may seem silly, but it can help separate those tasks from your normal relationship. Ask for help if you need it. Many services are covered by the government, and the person you're caring for might qualify to have help provided, like personal support workers to help with showers or nurses to help with a task that might scare you, like giving a needle. Last but not least, it's okay to have fun when you can and use some humor. When it won't hurt feelings, making light of a situation by joking around can help make the tasks a little easier, a little less awkward, and a little more fun. There are some tasks that will always be a little bit awkward, but giving these tips a try to see what works for you will help you both get through them a little easier. Be sure to subscribe to our channel.
If the person you're caring for spends a lot of time laying or sitting, they are at higher risk for getting a bed sore, which is also called a pressure ulcer. In this video, we'll show you some ways that you can help stop pressure ulcers from forming. Start off by keeping their skin clean and dry. Check over their skin daily for any red areas, especially over bony areas like their elbows, heels, or hips. Pressure ulcers can start to form in as little as 4 to 6 hours, so it's best to turn and position them or encourage them to change positions or walk if they're able to every 2 hours. Use pillows behind their back and between their knees in bed to help them stay off any areas that are becoming red or to help them stay in a new position. Using heel protectors while the person you're caring for is in bed can also help protect their heels from getting ulcers. If they're sitting up, specialized seat cushions are great. But you can also put a pillow under their hip and rotate sides every 2 hours to reduce pressure. Encouraging them to do range of motion exercises will help improve muscle strength so they can move around and change positions on their own a little easier. A diet high in protein can also help prevent and heal pressure ulcers because protein helps build and repair muscle and skin tissue. If the person you're caring for hasn't been eating well, speak to their doctor or dietitian about adding a high-protein nutritional drink to their diet. Pressure ulcers can be difficult to treat, so using these tips to stop them before they start will help prevent infections, pain, and hospital visits. For more information for caregivers, visit our website. If the person that you're caring for needs oxygen therapy, you may need to help them with it. In this video, we'll review how to set up and take care of oxygen treatment so you can keep the person you're caring for healthy and comfortable. Let's try it. Oxygen is very flammable, and safety is important. Before turning on oxygen flow, make sure there are no sources of heat or flame near the tank or around the person you're caring for. Oxygen can come in a tank or in a condenser. Start by setting that up near the person you're caring for. You'll also need the oxygen tubing their doctor said they should use, usually nasal prongs or a face mask. Last but not least, you'll need to know how much oxygen the person you're caring for needs. This is determined by the doctor, and the number of liters of oxygen per minute is how it's written. Never give them more oxygen than the doctor orders. Treat it like any other prescription medication. A condenser works by taking oxygen out of the air, so it won't run out of oxygen, but it needs electricity to run. If you're using an oxygen condenser, make sure it's plugged in. If you're using an oxygen tank, you'll have to make sure that the tank is full, but it doesn't need electricity to run, so it can be portable or used when the power goes out. For an oxygen tank, you'll have to attach the regulator dial to the tank to get started. Attach the tubing to the oxygen output valve and turn on the oxygen flow. You can do this by turning on the condenser or opening the valve on the tank. Next, turn the dial to the number that the doctor ordered. Hold your hand over the opening of the mask or nasal prongs and feel to make sure that the oxygen is flowing. If the person you're caring for uses nasal prongs, put them on by putting the prongs in their nose curved down and looping the tubing over their ears. If the skin behind their ears gets sore, there are foam pads you can buy to help, or just wrap a piece of gauze around the tube to make it more comfortable. If they use a mask, put the mask over their nose and mouth, then put the elastic strap behind their head. You can press the metal nose piece around their nose and adjust the elastic straps to make it more comfortable for them. If the person you're caring for is having a hard time breathing, sitting up can help. Using an adjustable bed or pillows to prop them up when they go to bed will help them breathe a little easier, but still be comfortable enough to sleep. Helping the person you're caring for with their oxygen will help them feel better, which will make you both breathe a little easier. Check out our care guide for more information about oxygen therapy and visit our website for more caregiver resources and videos.
If the person you're caring for wears false teeth, you may need to help them take care of their dentures. In this video, we'll review how to clean and care for dentures so you can feel confident helping them. Let's try it. Start by gathering the supplies you'll need, like a regular toothbrush and a denture brush, some denture cleanser tablets and/or paste, a water glass or denture case, a small bowl, disposable gloves, and a washcloth. After they remove their dentures at night and in the morning before putting them in, help them clean their mouth with a very soft toothbrush, making sure to clean all the surfaces in their mouth. To clean their dentures, wash your hands and apply your gloves. Then you can help take out their dentures and put them in a small bowl or denture cup in the sink. Putting a washcloth in the bottom of the sink will protect the dentures from breaking if you accidentally drop them. Using a toothbrush or denture brush, use denture cleanser and water to brush the dentures. Then you can rinse them off with warm water. Regular toothpaste can be abrasive and damage the dentures, so it's best to not use it. Check the dentures for any damage. If you see any rough or sharp edges or chips, follow up with the denturist that made the dentures to have them repaired as soon as possible. Using damaged or poor-fitting dentures can cause mouth sores and pain. Soak the dentures overnight in denture cleanser. To do this, place the dentures in a denture case or water glass with a denture cleanser tablet and water. Set the container aside somewhere safe for the night where it won't be knocked over. In the morning, when they are ready for use, rinse the dentures with water very well before helping put them back in. Following these steps to care for their dentures will help the person you're caring for feel clean, refreshed, and prevent mouth infections. It'll also save their dentures from getting damaged. For more helpful information for caregivers, visit our website.